So here we go, Chapter 1, the Introduction to Medical Terminology. Let's get started. Here are the objectives, which you can also read in the module. So crucial to the foundation of this course is understanding the word parts. Like most word parts, they are made up of parts that help us to understand the meaning of the word. Most of the words we use in this course are Latin in origin, some are Greek. The word parts refer to the word roots, combining forms, suffixes, and prefixes. The word root is just that. It's the root of the word, the base meaning of the word. A combining form is a vowel, and that's at the end of the word root that combines it with the suffix. Most commonly, that vowel is O. The suffix is, just like in basic English, is a word part that comes at the end of the word. Most, but not always, it can tell you the procedure, disease, or problem that's associated with that word root. A prefix, again, just like in basic English, is the word part that comes before, pre, that can tell you about the location, number, or time of the word root. The prefix and the suffix are descriptors of the main word root. So let's check it. The word part attached at the beginning of a word is called a what? So again, look, beginning of the word root. What's it called? Beginning, pre. There you go. Exactly. Good job. So word roots are the foundation of the word, the base of the word, just like the roots of a tree. They usually indicate which body part or body system the word is about. It can also be used to describe the color of a body part, just as it does in this list. So for those of you who look at your printer cartridges, cyan is blue, eryther is red, Luke is white, melon is black, and poly is gray. And again, the combining form is O. These roots with the combining forms, remember that's just the vowel that joins them with the suffix, show you which body part we're talking about. So ner is nerve, arthur is joint, osti is bone, my is muscle, and mile is spinal cord. So these two guys, my and mile, kind of similar. So that's where we really need to pay attention. That's really the reason we need to pay attention to detail. The combining form is a vowel, generally the letter O, and it's added at the end of the word root so we can say the word easily. It can join the word root to the suffix, or it can join two word roots together. If two word roots are used, the combining form, or the vowel, is used at the end of the second word root, but only if the suffix starts with a consonant, which makes sense, right? So if the suffix starts with a vowel, why would you put another vowel in the form of a combining form? You don't need it because there's already a vowel there. But if the suffix doesn't start with a vowel, then you need to add the combining form or the vowel to give it a vowel. So if it doesn't have one, you just add it in. When two word roots are joined, a combining vowel is not always added to the first word root, is sometimes added, is always added, is occasionally added. So when two word roots are joined, a combining vowel is always added to the first word root. When two word roots are joined, boy, I say that 10 times fast, a combining vowel is always added to the first one and sometimes added to the second one, but only if the suffix begins with a consonant. Remember, if it doesn't have a vowel, add it. The suffix, just like any other word in English language, comes at the end of the word root. It can tell you which procedure, condition, or disease we're talking about in relationship to the word root. A combining form or vowel is used when a suffix starts with a consonant. Remember, if there's no vowel, add it. If there is, you don't need it, right? So look again. we're talking about ner, which is nerve. The suffix is plasty or raphy, right? So P and R are consonants. Is there a vowel in front of it? No, so you have to use the combining form or combining word or combining vowel, which is essentially O. So neuroplasty, neuropathy. The suffix already starts with a vowel here. So for the word tonsil, which means tonsils, you have itis, which is the suffix. It starts with a vowel. Do you need to put another vowel in? Nope. So you just put the two together. In this field, sometimes the suffix changes the word root into a noun. So for example, crani means skull, and is a noun ending. So cranium means your skull. The word root cardi means heart, and the suffix ac means pertaining to. So cardiac means pertaining to the heart. Commonly used suffixes meaning pertaining to are shown right here, and also in table 1.4 of your textbook. So all of these mean pertaining to, including AC, which is the one we just saw before. So the question is, a suffix is always added at the end of the word to complete the term, is not always, sometimes, or is not sometimes? The answer is always. You always add the suffix to the end of the word. Suffixes can also indicate a condition or disease of the word root. So if you look at a suffix such as osis, meaning abnormal condition or disease, gaster means stomach, and osis means abnormal condition or disease of the stomach. Now, did you need to put a combining form in there? No, because this suffix starts with a vowel. Commonly used suffixes that mean the same thing are ago, iasis, or pathy. So when you see any of these, including osis, it means abnormal condition or disease. Suffixes can also describe different signs and symptoms of a disease. So for example, algia means pain and suffering, itis means inflammation, megaly means enlargement, and sclerosis means abnormal hardening. Suffixes can also tell you about the type of procedure in regards to the word root. So for example here, centesis is a surgical puncture to remove fluid in order to diagnose the problem. Graphy is the process of producing a picture or record. Gram is a picture or a record. So these can be used, but they mean the same thing. Plasty means a surgical repair, and scopy means a visual examination. So I'm just going to point out real quick here, these suffixes start with what? Consonants. So will they need a combining form or a combining vowel before it? Yes. The double R suffixes, such a conundrum, and I hate this because it makes no sense to me, but that doesn't mean it's not the rule or it's not right. There's always one rule in the crowd, right? So double R, there's some suffixes that start with double R's, and these are Greek in origin rather than Latin. Makes no difference because I still think it's creepy. So for example, R-H-A-G-E is Raj and Rajya, and I like to think of the two R's as a longer R, you know what I mean? So Both of these things mean bleeding. Raphe means surgical suturing, where you're closing a surgical opening. Rhea means flow or discharge, like diarrhea. Prefixes, just like the word indicates, is before the word root. Remember, pre means before, so it's before the word root. It can tell you about location, time, or the quantity of the word root, and it can also help to describe direction, size, and amount. So, for example, we look at the term natal, which means birth, right? So prenatal means before birth. Peri means surrounding the time of birth or around the time of birth, and post is after. This is where you can begin to see how important spelling is. If you spell something incorrectly, it can completely change the meaning of the word, which can completely change the information you are giving to another medical professional about a patient, which is pretty important. So paying attention to detail, as in all things, is especially important in the medical field. So, for example, AB means away, AD means towards, hyper means excessive or increased, and hypo means deficient or decreased. So prefixes are sometimes added to the beginning of a word to influence the meaning of that term, always, almost never, or never. Sometimes. So word roots do not always have to have a prefix. And sometimes they're confusing because they can be similar in spelling but opposite in meaning, which is why we have to pay very close attention to what we are saying and how we are spelling it. Breaking the word parts down helps to understand the meaning. You start at the end of the word and work towards the beginning. You break it down into different components, the suffix, the word root, and then the prefixes, there is one. And then you define each word part. You can put all the definitions together to determine what it means. And double check your definition with a medical dictionary, and most likely it's also listed in your text as well. So for example, I'm not even going to begin to pronounce this, otorhinolaryngology. The suffix ology means the study of. The word roots is larynx or throat. The combining vowel is not used here because the word root is joining a suffix that begins with a vowel, so ology, right? The combining form rhine, O, means nose, right here. So this is nose, this is larynx or throat, and this is the study of. The combining vowel is used here because the word root, rhine, is joining another word root that begins with a consonant. So rhine is joining with larynx, and they both end and begin with a consonant, so you need a vowel stuck in there. The combining form ot means ear. Ot ends with a consonant. Rhine begins with a consonant. So do you need a combining form here, a vowel? Yes, you do. The combining vowel is used here because the word root ot is joining another word root beginning with a consonant. So what does this mean? It means the study of the eyes, the nose, and the throat. So eyes, ears, and nose, throat, ENT doctor, or ENT, right? Here's an example of breaking the word part down sort of visually. I like this visual because it helps us to understand how all the parts fit together to create one word, which is what we just did. So sometimes, despite everybody's best effort to follow the rules, there's always those problem spots. So if you break down lithotomy as we discussed in the previous slides, you will see that lith means stone and otomy means surgical removal. So this describes a surgical removal if you look at just plainly how we have been breaking down the words. But in the clinical setting, lithotomy is also the name of the position of a patient. So it describes the female patient lying down with her feet in stirrups, for example, during a pap smear or a pelvic exam, or sometimes during birth. This type of confusion is one of many reasons why you use a medical dictionary, online resources, or your colleagues. So also super important is you always need to look at the context or the situation you are talking about. Are you talking about how to position a patient? Or are we talking about what type of surgery the patient is having? When you are in doubt, ask. This is where experience will help you figure things out, but always ask a trusted colleague. So, using your knowledge of work parts, you determine that the term arteriomalacia means tissue death of an artery or arteries, the abnormal hardening of the walls, the abnormal softening of the walls, or abnormal narrowing of the arteries. So you use the way that you break down the words, and you determine that arteriomalacia means the abnormal softening of the walls of an artery or artery. And you can look it up, but artery means artery. Combining form is O because malacia starts with a consonant, so you need to have a vowel in there. And malacia means abnormal softening, so it's abnormal softening of the arteries. The nice thing about using your resources is you can see different definitions all listed in one place. And here's some links for you in the syllabus that are listed as well as in the orientation manual. And if you can't spell it, you ask, right? You can always use the medical dictionary. This is how you can utilize it if you don't know how to spell the words or you're looking for multiple word terms. And if you're searching for definitions on the internet, I can't tell you enough. I say this many million times during my day. Please don't Google everything. Google has no filter. So it's going to pop up every single thing under the sun, and some of those things are not credible. So if you're looking for definitions, use a reputable site, and most of the terms that we're using are listed in your text. So when you're trying to find multiple word terms, it is not recommended to begin your search with the last term. It's discouraged, it's always discouraged, or it's recommended. It is recommended to begin your search with the last term. If you do not find it there, move forward to the next word. So, for example, the term congestive heart failure is sometimes listed under heart failure congestive. You'll have to search for the word instead of heart instead of congestive. So pronunciation is also important so that people can understand what you're saying. Not only does it lend to your credibility as a healthcare professional, but more importantly, you can correctly convey patient information. That being said, do not be afraid to say things out loud. If you don't say it correctly, someone will correct you. It's not anything to be embarrassed about, and it's not anything to be defensive about. It's a learning experience. I've been doing this for almost 40 years, and I still mispronounce things. Some words are just difficult to pronounce. There is more than one way to do things, including pronouncing things, so just jump in. And for those of you fortunate enough to speak another language, I encourage you even more. How wonderful to add that verbal flair to your terms, but even more so how important your ability as a multilingual healthcare professional is to patient care. The text will generally give you the phonetic pronunciation for the word, and practice makes perfect. Again, spelling is super important. Misspelling a word can completely change the meaning, which could completely change the information you are relaying about your patient or telling your patient. Changing the spelling of one or two letters in a medical term can completely change the delivery of a word, the format of the word, the documentation of a word, or the meaning of a word. It's the meaning. Accuracy in spelling medical terms is important. Inaccurate spelling of a medical term can completely change the meaning, which could have serious consequences for a patient. Because of the origin of the terms Latin and Greek, there are some rules that pertain only to medical terms and changing from singular to plural. So there's a table 1.9 for further understanding, and also in the text they'll usually put the singular and the plural together. So for example, the phalanx, which are the bones of the fingers and the toes, singular is phalanx, plural are phalanges. Which of the following is the correct plural form? Bursa, index, meningitides, and ovum. Meningitides. Many medical terms have Greek or Latin origins. As a result of these origins, there are unusual rules, and again, refer to table 1.9. So table 1.10 lists commonly confused words. So I don't know how acute and chronic can be confusing, because that's pretty self-explanatory. But acute is sudden, rapid, and severe. It's like right now. And chronic is like constantly there. Like chronic fatigue. All you mothers out there know what I'm talking about. So a disease, structure, operation, or procedure named for the person who discovered or described it first is known as a eponym, like Alzheimer's. A word form from the initial letter of major parts of a compound term is known as a acronym. So for example, laser stands for light amplification by stimulated emission of radiation. Some words sound alike but have very different meanings. A great example that has always tripped students up is this example below or in front of you. So arterio, athero, and arthero. Arterio means artery. Ather means plaque or fatty substance. And arthur means joint. Very different subjects. And some words just sound the same, like ectomy, ostomy, and otomy. So you just need to enunciate. Stuff like fissure and fistula. I don't think those sound the same, but you know, sometimes you can get confused between the two, and they are two very different things. Look how just one letter can completely change what part of the body we're talking about. So ilium, I-L-I-U-M, is part of the hip bone, ilium. Ileum, I-L-E-U-M, so we're just switching out an E and an I, is a small intestine. And this goes over that example. And infection and inflammation may kind of sound the same, not really. Not as much as ilium and ileum. And then there's laceration and lesion. And those don't really sound the same. But this one is also very important because they do sound the same. Mucus and mucus, mucus. I mean, that's how you can say it in your head, is mucus and mucus, but they're really both pronounced mucus. Isn't that wonderful? So mucus, which is the adjective with the extra O in there, describes the membranes that line the body cavity, like mucous membranes, okay? The noun mucus is boogers. And those are the things that are secreted by the mucous membrane. So mucous membranes make mucus. If that's not confusing, I don't know what is, but mucus or boogers. Here's some more example of sound-alike terms and word parts. myco, myelo, and my. So remember before in that descriptor of the body parts, my and myelo, two different things. Talking about bone marrow or spinal cord, and then you just take out the EL, and that means muscle. So if you don't enunciate and say mile or my, you can see how maybe people won't understand or they'll mistake something. Palpitation or palpation, that's another very common one. Palpation is a way to examine someone. Palpitation is a pounding or racing heart. So two very different things. Some more examples are pylo or pie or pyre. Supination is when you rotate your arm so that the palm of your hand is up, and suppuration is where you're making pus. So supination and suppuration. Triage, trauma, viral, and viral. Viral and viral, again, so viral means pertaining to a virus, and viral means having the nature, properties, or qualities of an adult male. Two different things. The word mucus can be described as a wound, a change of tissue, the membranes that line the body cavity, or the fluid secreted by mucous membranes. Membranes, good job, because you remember it. Mucus is boogers. Abbreviations that are frequently used as shorthand. But as I mentioned before, some abbreviations can mean several different things. So always look at the situation or the context of what you're talking about. If you're unsure, spell the whole word out so there's no confusion and less potential for a mistake that could potentially end up harming a patient. Here's some to never ever use. So the Joint Commission publishes an official list of commonly confused do not use abbreviations to prevent potentially fatal medical errors. MS, QD, and QOD, or U. And that's the reasons why they don't ever use them. An official list of commonly confused do not use abbreviations to prevent potentially fatal medical errors is published by, they just said, the Joint Commission. And those are the people that come and inspect your hospital to make sure the standard of care is where it should be.